Welcome to the Center for Hope's annual Chairman's Reception. Thank you for joining us. We at the Center are always aware that our continued success depends largely on our donors, partners, and community supporters. We welcome you tonight as our partners in providing the finest hospice care to all those who need them. From the beginning, the Center for Hope has been a leader in the provision of hospice services. As the first freestanding hospice in the state, many of the services we think of as being standard were introduced as innovations during the early years of the Center's existence. As our innovations became standards, our standard became innovation. Today, the Center has grown from a volunteer-based hospice to a highly professional medical service that can manage complex symptoms associated with end-of-life care. As a nonprofit, we've grown to providing over $3.5 million in charitable care year after year. However, the Center has never forgotten that our patients are our neighbors, and more importantly, they are someone loved.
My family has appreciated hospice. As I say, it rubs off on anyone who deals with them, either as a patient or as the wife or son or daughter of a patient, because goodness is goodness, you see.
Today, the Center operates 2 state-of-the-art facilities in Union County. Peggy's House, named after one of our founders, is the Center's Scotch Plains residence, with 30 private single-occupancy suites spread over 3 wings, restaurant-quality food, various sitting areas and public spaces, beautiful outdoor gardens and views, and of course, the finest in around-the-clock care. Peggy's House offers a peace of mind like no other. The Center's Elizabeth residence provides the majority of the Center's charitable care. Just like Peggy's House, the residence boasts a comfortable atmosphere for patients and families alike, as well as an unmatched quality of care to those inside its walls. Recently renovated, the Elizabeth residence offers those in need a special and unique comfort when most thought comfort was lost.
Center for Hope started more than 35 years ago as a purely volunteer organization. Over the years, we've done a lot of innovations. We developed a model for in-house residential care for hospice, and most currently, we've developed a model for around-the-clock, awake and on-duty staff that replaces the outmoded on-call system that's often been used in community health.
I think the patient response system is a very good system to have. We provide a live awake nurse 24/7 who is available to run to a patient's home in the event that the family or the patient feels that there's a need for someone to see them. There's been several times when I've gone to someone's home and more to comfort the caregiver who feels like they're not doing enough or they're not sure how to do something and they just need to be shown that they are doing it okay. And if they're not, to be shown the right way to do something. So to sit with them and comfort them and to educate them on what to do for their loved one is part of the runner's aspect of their job.
Our patients, our physicians, our families have literally 24-hour access 365 days a year. Regardless of holidays, we are staffed around the clock. When someone calls us, they reach someone who is on duty, awake. It's not an answering service. It's one of our care supervisors who's on duty to make sure we can respond with education, concerned support for the family, emotional support, and also to deploy a nurse to go and visit the person any time of the night or day who is already on duty to go and help that family and that patient with whatever the current need is.
So there was one case in particular where It was overnight. It was about 1 o'clock in the morning. The patient was in extreme pain. I was able to go out, visit the patient. We were able to keep the patient comfortable. More importantly, we were able to keep the family free from distress. And it's that quick response that's able to give the patient the comfort that they require. A patient in hospice, at the end of their life, if they have to deal with some type of pain that can be controlled or that can be alleviated, but they have to wait, I can't picture, the pain the unnecessary pain that they would be going through. So.
Our main focus has always been and will always remain individualizing care for the particular patient and their family in the context of where and how they're getting help. We have had a number of doctors use us preferentially because we will take on unusual cases. We will develop with the doctor protocols in the field for things that we normally might not have considered in the past. But our focus, our priority is to help meet the needs as they are now. Many years ago, it was almost unheard of to do intravenous care at home. Now it's routine, and we look forward through many other models of more advanced care and different procedures that can be used, keeping people at home while they're under end-of-life care so that they do not need to return to a hospital. Another aspect of our individualizing patient care is to make sure that we're staying in close contact with the patient's long-term attending doctor, a physician who's been involved with the patient through the course of their care until they come to us, needs to know what's going on. We need that doctor's history, and we will stay in touch with that doctor, even though our medical directors can assist with consultation in the complexities of palliative care at the end of life.
I feel that keeping in touch with the primary doctor is very important, both for the hospice nurse and for the patients. Sometimes these primary doctors are with their patients the past 30 to 40 years, and I feel it makes the patients more comfortable and more secure that we are in touch with their primary doctors. And I've talked to many primary doctors, and they are very thankful that we speak to them and we update them on patient care.
The other area I'd like to speak to is the continuum of care. How do we help to make sure the patients who are in one system, such as in a hospital or other medical setting, how do they transition back to appropriate care out in the community in their own home, or should they need to even come into one of our unique residential care centers?
What Center for Hope provides that's really unique is that as an on-call nurse, I can go out and visit the patient and comfort the patient, comfort the family, deal with the symptoms, and if we're unable to help the patient in their home, we can immediately bring the patient in here. That's something that's unique, that a lot of hospices physically don't have the structure. We have it here.
One of the things I'm most proud of that the center has been able to not only maintain but to grow over our years here is our charitable care program. The service that we provide is only partially covered by insurance payments, and many people simply at the end of life do not have the means to pay privately for a care in either our facility or elsewhere. This is where our charitable care program comes in.
As part of the process, when patients are referred to our facility, families will come and tour the facility. It's not uncommon sometime during that tour for them to become tearful. They never thought they'd find a place like this to provide the care and to the environment that is as lovely as this is, that will provide charitable care. We wouldn't be able to do that without the support from the community, from our donors, and it makes the biggest impact to all of our patients.
The fact is that there are no other places like this, at least in New Jersey. So people who need to be discharged from the hospital, don't have a home to go to, don't have a safe environment to go to, there's nowhere else to go. So Center for Hope provides a service that nobody else does. It also provides that service to people that nobody else wants to serve. And I'm grateful every day that I get to work here and be a part of that.
and thanks to the generosity of our donors and the support of referral sources that help to keep our services and our service volume robust, we were able to provide over $3.5 million in charitable care to the community as of last year. We hope, with the support of our referral sources and the community at large, to be able to continue this for many years to come. Thank you all for joining us. I'm Frank Brady, President of the Center for Hope, and on behalf of myself, our management staff, and the Board of Trustees, I thank you for joining us and for all your support.
Thank you for attending tonight and for supporting our mission. If you'd like any additional information on the Center for Hope, please talk to a staff member or trustee in attendance.